Welcome to Health Hour, a session for you by Black doctors, hosted by the Caribbean and African Health Network. Ever sat in a doctor's office thinking they just don't get it? Or search for health advice online, but you can't understand it? Felt unheard? You're not alone, and you found your solution with Health Hour. Every Saturday at 11 a.m., this is your space where Caribbean and African healthcare professionals speak about health with a focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more. All with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health expertise.
Hi. Hello, everyone. Good morning. Hope we're all having a lovely weekend. Welcome to today's health session. My name is Tayo, and I'll be your host today. Please let us know where you're tuning in from around the globe and any potential topics that you want us to cover. Today we have with us Dr. Mohamed Kamara, who is a consultant in emergency medicine in Greater Manchester. He is also an imam, community leader, and health advocate through the Well Body Better Past Gentry, and also a long-term supporter of Khan. I'm sure some of you might have seen his face before. Over to today's health topic. Today is covering staying healthy during Ramadan, which presents health considerations, particularly for individuals with long-term conditions. He'll be going through a variety of topics under this topic. So please make sure to listen carefully throughout the session, write down any questions you may have, as there will be an opportunity to ask them during the Q&A at the end. Over to you, Dr. Kamara.
Yes, thank you so much, Tayo. Thank you, everyone. A very good morning from Manchester, and thank you for having me again. I don't think I need introducing, but maybe some people haven't seen me before. As it is, I'm one of the very few people who are still misters who are in accidents and emergency. So I'm a consultant, and I'm also one of the directors of Khan. Now, as we all know, Ramadan is just around the corner, just a few days away. And of course, there is also Lent, and there is also all intermittent fasting. There's a lot of things that involve fasting. So I wondered if you can, this is what we're going to be looking at today. It looks busy, it looks big, but obviously it's doable. I think we can do it, and this is what we have. So we've got initially something to whet our appetites, and then we move on to the definition of fasting, the patterns that we have of fasting, and obviously what you need to do before you start your fasting in terms of making sure that you are assessed and given the green light or the all clear for you to be able to continue with the fasting by talking to your healthcare team. Then, of course, there's guidance specifically for Ramadan. And of course, we'll look at the human digestive tract, which a lot of people might find fascinating. When you fast up to 24 hours, what happens to your body? And then further on, up to 5 days, and of course, towards the end of the month, what would happen? We look at the the foods that we class as healthy for when you're fasting, and obviously afterwards as well. And what would be recommended for breakfast, i.e. breaking fast, iftar, the benefits of the fasting, of course, the journey you will take, what are the benefits and what are the risks. It's important to remember that the fasting, although it's good, generally, spiritually, emotionally, physically, but there are also risks, and you need to be able to understand what they are in order to see whether indeed you're capable of doing that or not. How you can fast safely, what is not recommended for you when you're fasting, and of course, specifically to our own people, the BME or BEM communities, general principles when to break the fast immediately, i.e., the red flag symptoms when you're observing fast, and what it is that you notice in people who are fasting that you warrant them to break fast or help them to break the fast. Then you look at the extremes of life. You're looking at the young and, of course, the elderly. And then, of course, how do you fast, in a way where it becomes easier for you? And then, of course, the summary and the takeaways. What I wanted to do was probably ask the host or anybody who can unmute the audience, and please just tell me. I know many people know what this is, but some people don't. So if you do know, please tell me, help me. What is this? What do you see on this diagram or this picture? It's not an exam. It's not a test. I just want to find out what people know. Anybody?
Is it the stomach?
Which one is the stomach?
The pink thing.
Yeah.
Yeah.
Yeah, this is the stomach, yeah. Cut into half. So the cross section, yeah. Anything else you can see? What is this?
The liver?
So yeah, the liver. That's right. Very good. Yes. And what's this?
I think I can see the spleen.
The spleen. That's what it is. Definitely. And of course, what are you saying?
I was gonna say, is the pancreas there as well? Or?
Yeah, the pancreas. That's it. It looks like a loofah. You use, yeah, that's it. That's the pancreas. And what's this? This green thing.
Is it the bile?
The duct. That's it. Bile duct. That's it.
Yeah.
So here you are. I'm glad
thank you,
people know
Dr.
the
Kamara.
anatomy. Yeah. Good that. So this bit is what? This bit.
There's sphincter.
Yeah, there's a sphincter here. And this is the food pipe, as it were. So when the food comes down from the mouth, it is swallowed through this very muscular organ called the esophagus, the food pipe. And then it enters here by this sphincter relaxing, and then goes into the stomach, and then it closes behind it after the food goes in. And of course, this is where the digestion of the carbohydrates take place. And then it goes through. There's another sphincter here, which then relaxes to allow the food, as you can see there, illustrated, into the small bowel. That's the duodenum. And look at that. These twins, beautiful. So the liver has got this pear-shaped organ here, which is called the gallbladder, and it releases the bile through the duct that gets into here. And then this, as we said already, is the pancreas, and the pancreas releases the pancreatic juice. And of course, insulin that you hear about with diabetes and glucagon also comes from this. And there's also another one, but that's for the medics. So the two of them empty into here, the small bowel. And this green one digests the fat, and this white one digests the carbohydrates. So they live very, very, I'd say, amicably, friendly. Very rare you see them fight one another. This can happen, and we'll talk about that. But this is just a schematic. So as it is, the digestion doesn't just start in the stomach. It starts from the nose, where you start perceiving the food. And then, of course, the salivary glands come into, kick into action. And then, of course, they start getting ready for the food. Then the tongue and the teeth masticate, they chew for you. And then there, the carbohydrates are beginning to be digested already. And then they get swallowed. And in the stomach, well, I'll tell you this. In the stomach, this is a very, very concentrated juice, hydrochloric acid here, really concentrated that it can burn you. Hence the reason why God created this and put a sphincter. So this doesn't go back. When we eat, we swallow air, it goes in with the food, and then the food goes down because it's heavy, and the air goes up because it's light. So when it goes up and we burp, when you're burping a baby, that's what you get. It goes up, and then it causes problems because it goes and burns this place. This place has got mild alkali, and here you got very strong acid. That's what causes this problem. And sometimes people get reflux, they get heartburn and things. The liver, obviously, is a very important organ, and it helps with this. The pancreas is also important, but not as important as the liver, because it's got other things to do. And the spleen is the graveyard for the blood. Yeah, if you don't know this, well, the blood changes itself. The human body changes its blood once every 3 to 4 months, so 3 times in the year. For people that have sickle cell, theirs is a lot more, and therefore there's a problem sometimes because of the shape of the blood. Instead of being round, is sickle shaped, and then it destroys itself easier. So, what is fasting? I wondered if people knew about it. Somebody help me with fasting. What is fasting? A lot of people will say it's Ramadan. Yeah, it's Lent if you're a Christian, Ekadashi if you're a Hindu, and of course Yom Kippur if you're a Jew, and the Buddhists have their fasting as well. But what about if you had food at say 7, 8 o'clock at night, and then you didn't have anything else until the next morning, maybe 10, 11, or maybe 8 or something? Is that fasting? I would say yes, that's fasting. So therefore you need to be mindful of what you're using to break that fast. This is what is the confusion. A lot of people do not know what is fasting. It doesn't mean if you're fasting for Ramadan, that's obviously religious as well as Lent, as well as Ekadashi and Yom Kippur. When you have something like intermittent fasting, as we find out as we go along, it's a different thing. It's meant for medicinal purpose, for therapeutic reasons. So we need to understand that there are disparities and baseline health risks that are very high in our communities. As you can see, the South Asians, they're like up to 6 times more likely to become type 2 diabetics because of the heritage, as well as because of the lifestyle, as because of also the diet, And so all of these things have to be taken into account. Of course, with our people, the Black Caribbean or African Caribbean people, population, as you can see, 3 times more. So it's half the likelihood. But then there is this issue of hypertension as well, which obviously we know is very significant in our populations. So when we understand the health disparities, then we know that we're considering the appropriate way of fasting in order to help ourselves get better health-wise. Yeah, those of us who are high risk, because it runs in families, then obviously we need to be mindful of what we do in order to be able to live longer, live healthier and better. With that, you get spiritual growth, you get emotional well-being, and of course you get mental clarity when you do these things. So in terms of Ramadan, you know that you're not allowed food from dawn till dusk. Now, it doesn't just stop there. People think that it's just because you can't eat or drink from dawn till dusk. That's what Ramadan is. We're far from that. It's a lot more than that. The whole body fasts. I don't have time to go through all of it, but all of the 5 senses in Ramadan, they do fast. Yeah, there are things you can do, there are things you cannot do when you're fasting in terms of Ramadan. Lent, again, you're reducing the certain foods or certain kind of times or dishes in terms of fasting during the Lenten season, which I know lasts up to 40 days, as I'm told. And then, of course, when you look at the intermittent fasting, some people do 5 days of normal eating, and then the 2 days they don't. Some people do red and green days. Some people do 16 hours and 8 hours. Yeah, so they don't eat for 16 hours, and then for the 8 hours they eat in between. So it all depends on what you're doing, and people rotate it, as it were, from calories per day to the other day. It's important to remember that fasting has got its benefits and its risks, and we'll find out as we go on. So before you embark upon this journey, be it religious or medicinal or therapeutic, please get yourself checked. It is important. And in fact, you should have done that at least a month. Ideally, you can do it 2 months before. So you need to be discussing your plans, and they'll take you through some rigorous tests, blood tests, ECGs, echoes, and all of that. Then, of course, they'll be able to put you in a class or category where you'll be able to be given the green light to fast. The medications will be removed, will be reviewed, because people take medications at different times. Now you're going to be taking them completely different from where you used to. So you definitely know that something like short-acting insulin, for example, can be changed or swapped to long-acting insulin. Yeah, instead of taking the antihypertensives or the medication for hypertension, you take it instead of in the morning, you take it at night. Yeah, and it does work. They can change it to the long-acting one. So there are a lot of things that the healthcare professionals can do, the pharmacists can do, the general practitioners, even us as medics in the hospital can take you through. Yeah, they look at your targets, and of course they'll check your sugar levels, your blood pressure, and they will know what are the red flag signs to look for. But when you communicate regularly with the healthcare system, you will find out these things, and you know exactly where you are. As I said already, this is what you're looking at. So you're looking at the assessment, as you can see. Yeah, they do the assessment. This is what you get. They class you on the green, as you know, the green light system. If you're green, then you can choose to fast. So you're okay. If you're yellow, then you can fast with caution. Remember this. If you're definitely amber, yeah, as you were, or maybe orange, then obviously getting closer to the red, you may choose not to fast. And definitely, if you're red, well, 100%, I won't advise you to fast. There's a lot of things that you see here on this red. You can see the ketoacidosis, you can see the type 1 diabetes, you can see labor, i.e. pregnancy, people with kidney diseases, stage 4, 5, dementia, people with malignancy, people who've had a stroke, who obviously have problems swallowing and all that, and if the blood pressure is uncontrolled. So you would have been assessed and you'd be put into this one of the 4 categories. Once you are allowed to fast, you can continue to fast, but be mindful things can change. And when they do change, you need to know the red flag symptoms in order to break fast. There's no shame in admitting that. But one thing people don't do is that on the days of Eid, the 3 days of Eid when you celebrate, they undo all of the good that they have done already throughout that month. And therefore, it is important to be checked out. So after Ramadan, after the 3 days of Eid, please go back and get checked. Yeah, because as I say, people indulge themselves, they overeat, they eat the wrong things, and then they end up, undoing all the good that you've achieved. So you need to be checked out. I like this slide. The one on the right, the one on the left, they're equally the same, but I think the one on the right is better because people like infographics, they like the color. So as I was saying already, I told you about the tongue and the role. This is the digestive tract, as you can see it. Yeah, the tongue, what it does, saliva and the enzyme there, you can see yourself what it does, and the swallowing. So the chewing is by the teeth. The tongue helps to, soften the food, and then of course you swallow. You got the salivary glands here and underneath there as well that help in the digestion. And then of course you can see this worm-like action called peristalsis. It goes from top to bottom, top to bottom, top to bottom. So it goes like that, seamlessly, really nice, without problems. Yeah, and of course it empties. But when it goes the other way around, if I can get my mouse, so imagine this is going down like that. When it goes the other way around, what are you doing? You're vomiting. Yeah. Again, this sphincter here has to open to allow the vomit to pass through here. When you're swallowing, when you're eating, it goes that way because that's how it's been designed to work. And here in the stomach, as you can see, I told you about this hydrochloric acid and obviously the other enzymes that help. And of course, it moves into the small intestine again after it goes through this barrier. And in there, we talked about it already, the gallbladder, pear-shaped, and of course the pancreas, and the duct, and the meat here. And then of course, the pancreas has got this amylase, pancreatic juice, and then the gallbladder has got the bile, and then they digest this one for the fat, this one for the carbohydrate, and then it moves into the lower sections of the small bowel where the absorption takes place and then it gets to this bit here where it finishes, then it goes into the large intestine. And what you see here is the appendix. So the large intestine is on your right. It starts from your hip region and it goes up to your ribs, and then it turns left, yeah, across the belly, the left ribs, and then it goes down, and it goes onto the left hip, and then it goes in, then it goes out again, straighten out, then it comes out, and this is the back passage. So in effect, you have the ascending colon, as the name implies, it goes up, the transverse, it goes that way, the descending goes down, of course, and the sigmoid, which is shaped like an S, as you can see. That's why it's called the sigmoid. And then, of course, you got the rectum, which is straight. That's why it's called the erector. And then, of course, the back passage, the anus. So one thing this large bowel does, is absorbs the water. So when the food has been digested, it comes in the form of water, very really liquidy. And then, of course, when you get diarrhea, you know what I'm talking about. Yeah. So it gets to be absorbed. Water gets to be absorbed, and it becomes solid. And that is what helps you with the motion. When you release it, it's solid. Yeah. So this is just a schematic view or representation of what happens when you eat. So that brings us segues nicely to what happens when you fast. As you can see, between the first 3 hours, you'll find out, there's a beautiful slide about the number of hours of the time certain foods spend in the belly and how long it takes to digest them. So as you can see, between the first 3 to 4, 5 hours, the digestion takes place, and then thereafter, what you have is you're now in the state of the body sort of going into the liver, because the liver is the bank, as we said. This is why it stores all the extra. That's what I was trying to tell you. It's a very important organ. So it stores all the extra carbohydrate in the form of glycogen. And so when you're now fasting, the body wants, to be replenished, the levels, but you can't do that because you're fasting. You can't eat, you can't drink. So therefore, the body then, the brain tells the body to go into the liver to call on the debt, i.e., what was there that was kept. And now that glycogen is now, if you like, broken down into the carbohydrate, the glucose that you need to help you, to prop you along all day long, especially the brain, and of course the other one. So that's what is called gluconeogenesis, as you can see here. So fat metabolism is kicked into action when this happens. And then, of course, the muscles that have got fat also break down to give you this protein and the energy that you need and the acids that you need to get you going. The hormones do change, like the ones that help with the growth, they change as well, and they help with the fat metabolism, and they help with the repair of the tissues, which is what happens that you don't know about, but that's what's going on. There's a enzyme called ghrelin, which reduces when you're fasting, and then leptin goes up when you eat. So that's the kind of thing that does happen, which you don't know about, but that's what is helping you to sustain yourself as you go. So after 24 hours to 48 hours, it becomes more difficult. So as you can see, the glycogen, which was in the liver, is now depleted because the body begins to ask the liver as the bank to give off. You're now in a, what do you call it? You were saving for a rainy day, and now it began to rain, and now you're actually asking the liver to give you that. So you then go into ketosis, like I said already. Now it's the body, burning, working itself on a status where it's the fat that is being burnt, yeah, by mobilizing the fat, and you get to get going without you even noticing it. But the fasting becomes more difficult in the 48 hours. The second day of the fasting is when it's most difficult, because that's when the whole body recognizes, oops, I've been exposed to something else. I was used to eating 3-4 times a day. Now I can't eat that way. So now my body then has to adjust. And the second day is when the adjustment kicks in big time, when you begin to get into ketotic phase. In that phase, or in that situation, you get what we call autophagy, which is a cellular cleanup process. It removes all the damaged proteins and then repairs it. Yeah, the growth hormone is increased, dramatically. The insulin drops significantly, and of course, those who have mental fog or brain fog, they get better as the days go by. As you begin to burn the fat, you definitely get better from the second day onwards. So you can see all the systems are affected. So between the third day and to the fifth day and thereafter, you can see what I'm talking about. It gets better and better and better. So you then begin to notice you're burning the fat, your face begins to obviously look a bit more, go on the watch, begin to dance on your wrist, the skirt or the trousers, you begin to feel them getting a bit looser. Yeah. And the cardiovascular system, believe it or not, gets better, where the blood pressure gets reduced. And with that, obviously, you get the sugar control, or the sensitivity to the sugar, insulin is better with this particular situation as well. The body repairs itself better because that autophagy is triggered into action. And it does that well when you are in the state of that ketosis. The metabolism improves, and of course, the digestive system gets better because you're resting it at night and you're allowing it. Believe you me, although we're getting benefits from it, but there are things like the biome, which is the gut of the gut, the flora, the bacteria of the gut gets better. It's well balanced and it increases the nutrition absorption. And of course, the poisons that we get from our food, believe it or not, like indole, phenol, and skatol, they get better and they get excreted, taken away from the system as well. The nervous system also gets better, the memory gets better, and of course, the protection of the brain, spinal cord, and the nerves gets better, and the brain fog gets better. So this is just telling you what we've talked about already, that you get deep renewal at 2 days. So the second day is most difficult, but thereafter, from the third day onwards, you get maximum regeneration. You adapt better, and obviously you feel better for it. So that you can continue as long as you want, even after the month ends. So this is a very good slide. I liked it, as I hope you do. But you can see that the least of the food that we eat that gets digested shortest, if you like, the least taxing is the banana. The most taxing is cheese. So this is why the athletes, you can see the tennis players, the runners, and all that, they definitely thrive on this, because not only has it got fiber, it's got energy, and of course, it's got potassium, which happens when you run too much. When you exercise a lot, you lose from the sweat a lot of the nutrients, a lot of the micronutrients, the electrolytes, and so therefore it's important to remember that. Followed by the apples, and then of course look at that. The white rice takes an hour. Avocado is good, yeah, it takes 2 hours. The nuts, the eggs, 2.5, and look at that. Our favorite, chicken and the meat, 3.5 hours each, and of course cheese, you can see almost 5 hours. So this is the rainbow plate. I don't know if you've heard about it. I like it because it tells you for the brain, as you can see, these are the food stuff that you need for the brain. You can see that fish, salmon, tuna, sardines, and of course nuts. It improves the memory and the cognitive function. For the lungs, as you can see, you got the greens, cabbage, broccoli, and sprouts, and it helps with the respiratory. And the heart, obviously tomatoes, again broccoli, and of course and carrots. And then of course you got the bones, obviously the milk, we know, celery, orange fruits, the fruits like citrus fruits, and of course the intestines, they thrive on prunes, as we know. It's a natural laxative. Yogurt helps the digestion. Skin, of course, it just thrives on fish and green tea, as well as blueberries. They are the least sugary of the fruits. It enhances hydration. And of course, the muscles thrive on the proteinous foods as well as the bananas, the meat, the fish, the eggs, and all that. But please, please, please prioritize whole foods, limit the red meat and the processed meats, aim for a balance. It's quality, not quantity. Remember, don't eat the same thing every day. Vary it, and the proportions, the portions of it, definitely important. And hydration is important because, believe it or not, the human body comprises of 70% water and 30% solid. So you can see that even the blood is hung in water, the muscles hung in water, the bones have water in them. Of course, the intestines thrive more or work better with water. This is another one I like. This is for us, but it was provided by somebody we know. I was with a couple of weeks ago, Dr. St. John, yeah, we're proud of her. This is the kind of thing we have. I don't know if she's aware of this, but there you go. So if you look on the left, we like our fish stew and coconut rice and plantain. And on the left, we like our fufu and peanut. But you can see that, you can see the portion size, you know, here compared to there, and of course there. And you can see with that, look at the calories. They double, and here, they almost quadruple. So you need to know, and if you look at this, you can see the meat more, and of course, most, yeah? So same here. Look at this peanut soup, yeah? You look at the fufu size, look at that. It's now 1.5 size, the size of that, or maybe 1.5 times. And then of course it's like, again, 1.5 times, and then of course there, twice. And then you can see that twice as well. Again, with the calories, you see, 420, doubles there, and trebles there. So it just goes to show you. So it's actually quality, not quantity. And with that, you can definitely benefit both emotionally, physically, and spiritually. Because if you're not unwell, you can worship better. So when you're breaking the fast, what you need, whole grains, lean proteins, beans and lentils, and of course, vegetables and fruit. Remember, olive oil, plant protein, plant oil is really good. The nuts and the seeds, the avocado, we talked about already. But remember, people always think, oh, when I break fast, I should delve into deep fried foods. Not true. Need to limit that. I'm not saying don't eat it, but limit it. Okay? Sugary snacks, limit that. Caffeinated, caffeinated drinks, energy drinks, limit that. If you can, avoid totally. Avoid the salt. Very high salt content is not good, especially if you have diabetes, and with that you have hypertension as well. It's not good. Yeah. So that combination is not good. So therefore, you need to limit these foods I'm talking about. Oh, as I said, there's benefits, there's risk. The benefits are obviously weight management. You can lose weight, especially the visceral fat, right there in the middle, the love handles. As you were nowadays, we're not looking at BMI. We're looking at the mid what do you call it, the circumference. We talked about it a couple of bit. The circumference between the ribs and of course the hip, that middle layer is actually what would determine how high a risk you have, or how risky where you are in the risk register in terms of developing diabetes or blood pressure. Again, the heart gets better because for the blood pressure to go up, it's because of the tension, the pressure with which the blood is pushed out of the blood vessel. So when that's low, it'll flow better. And of course, if you have a reduced cholesterol or fat, lipids, then definitely it would flow well. The blood will flow well because the blood vessels around the heart would act better and perform better. And so obviously the cardiovascular level of wellness would increase. Of course, the sugar, the HbA1c, as people like to call it, because they remember it easier. It's called HbA1c. They call it HSBC, the bank. Yeah, it's easier to remember. It's managed correctly with the blood control, sugar control. And of course, that fog we talked about, mental fog, is definitely well controlled, is better. Okay. So understanding what it is with Ramadan specifically, this is your journey. You start, maybe dawn. As you can see, this is a short period of time, although it might be getting longer, because it's getting lighter and lighter every day. However, it's far better than about 6, 7, 8 years ago when we were fasting in the summer months. In fact, God willing, by 2030, it'll be the shortest period of time you'll be fasting for Ramadan. In fact, it is that year when you'll be fasting in January, and the same year you'll be fasting in December. It happens once every 33 years. And this is the same time that it would happen in 2030, 2031. Yeah. So you eat, and then 3 hours later, 4 hours later, digestion finishes. And then you go into that state I talked about, where the absorption is finished. And then the glucose is utilized from the bank, the liver, and then the metabolism of the fat begins. Yeah. And then, of course, it's done in such a way that even though the muscles do break down and provide this fat and energy that you need, it doesn't go into atrophy where it actually collapses. No, it doesn't, because when you break fast, it replenishes it to a certain level. If someone is anorexic or bulimic or maybe can't eat for some reason, then obviously that's when the muscles break down. Yeah, there's a gentle transition you need. Therefore, you need to be preparing for it. Like myself now, for the past 2-3 weeks, I was preparing. And for the Muslims, obviously, Rajab, which is the month preceding Shaban, which is where we are now, is when you begin to sow the seeds, plant the seeds, and then you water the seeds, and you get your products. And then in Ramadan, which will be in a few days, is when you harvest. So, as I say, Benjamin Franklin, just very clever man, American chap. He said, failing to prepare is preparing to fail. So if you're expecting this great visitor to come, you should be preparing for them. And what you do is cut down on all the other habits that you had, the smoking, the caffeine, the feeding pattern, because it changes, the circadian rhythm, all of that changes. And therefore you need to prepare and ease yourself gently into that. Yeah. You can definitely get benefited from this because of your health, your emotion, your spiritual aspect. You detoxify the body and your mental well-being is good. Yeah. But remember, with any benefit, there's also a risk. Hypoglycemia, the sugar can go down. You can definitely become jittery, sweaty, and trembling, and obviously you can be found slumped. So if nobody knows you're diabetic, clearly it's dangerous. Therefore, if you're working, you need to be notifying people to know that, you're diabetic or you're hypertensive and things like that. Dehydration is a big thing. Yeah. You can get dehydrated because you're used to drinking maybe every hour or something. Now it's like 10, 12, 14 hours. Clearly, it will cause you problems. So therefore, you need to rehydrate. Yeah. The electrolyte imbalance will definitely take place. There's no questions about that. You will lose nutrients, you lose electrolytes, and that's why you need to be replacing them. Yeah. But remember, there is this refeeding trap which we need to avoid. Yeah. The deep fried starters we talked about, the high sugar desserts, all of that will undo the good in terms of the metabolic benefits that we've had. So this just tells you the common short term on your left and the ones that are most serious on the right. As you can see, you can get hungry. Some people, during this fasting, get hungry, which is they can get easily irritated. Yeah, headaches definitely can happen. You can feel lightheaded, dizzy, and you can obviously collapse. And of course, you can get brain fog. And of course, on the other side, you can get low blood sugar, which we know already. You can get dehydrated, electrolyte imbalance. And of course, the blood sugar can drop and you can get fainting. And sometimes that can cause falls where you can injure some parts of your body. So, worst of them is your head, especially if you're on blood thinners. You can end up with a bleed. Or if you end up with your arms or your hips, you can get fractures, especially for the elderly. Yeah. When you do fast for a long time, you get this wastage of muscle, as I say, and that doesn't help. But for you to be able to assess whether you're able to do that, remember, you need to be assessed by the appropriately trained clinicians. So, safety that we have to observe. Hydration is key. Yeah. As we said already, caffeine, limit it. Nicotine, definitely limit it. The rainbow plate, as you can see, should be divided to 40% vegetables and salad, 30% proteins, and of course, 30% carbs, which is what we don't do. We go 60 carbs, 30 this, and 20 this. It's there, 40, 30, 30. The carbs should be less in comparison to the protein. Yeah. Remember, for suhoor, which is the meal before you start to fast, it's important to remember that the porridge with nuts, the rich protein foods, and the whole grain toast are preferred because they slowly release the energy for you. They're really good. Which you don't want is something that would actually spike your sugar later on, and of course you become dehydrated. You then get the insulin going up, but then the substrate goes down. You don't want that. So this fasting not recommended, but we knew that already. Yeah. Type 1, diabetes, and type 2 sometimes, not all. Yeah. If you got heart disease and you have to take medication, heart failure and all that, you got to be careful. Kidney disease, obviously, because you get dehydrated, the kidney performance can reduce, can worsen, and so therefore there's a problem. If you've got an ulcer, active ulcers, where you have this heartburn and you have pain in your belly higher up towards the chest, and it's not remedied by the tablets you're taking or the medication, then you got to be careful. Liver disease, again, you have to be careful with that. If you're pregnant or you're breastfeeding, or the younger ones, the children under 12, and of course, if you have problems with eating disorders like bulimia, anorexia, and of course, if you have to take tablets at random, and not random, at various times of the day, 3-4 times of the day, definitely you cannot do that. Okay, remember, your health or your life was loaned to you by the Creator, and you need to justify the loan. Otherwise, there's no spare in the bank for you. Okay, there's health disparities for us, the BME population. As you can see, kidney disease, we're very rife. We're more likely, strokes, we're more likely, blood pressure, of course, diabetes, these are all more likely. Therefore, believe it or not, as I tell you, 14 million people in the UK have got hypertension, and they do not know that. 14 million. So imagine, most of them, some of them, they actually find out they are hypertensive when they land in my department in the A&E with a stroke or with a heart attack, with a kidney failure. Some of them, obviously, when they go into a coma, that's when they know about the diabetes. Again, 1 in every 3 individuals is diabetic, and they don't know it. So it's important to get checked. Because of that, you would prevent, and you would actually live a better life, a healthier life. There's no questions about that. We need to have the respect for the faith practices anyway, but however, we need to be kind to ourselves. Whether you are of any religion, your health is your health. It's as simple as that. If you want to, you can check with your faith leaders, your professionals, your community champions, and of course, the ones who are trained specifically for this kind of thing. So this is just telling us that don't jump in. As I said already, gradually ease yourself into that. It's important that, because that's the way you can get benefit, plenty. Drink plenty of water, avoid the caffeine, the sugary drinks. Don't overeat, please, whatever you do. Because for one, you won't be able to pray, you won't be able to be effective in your community, and of course, you'll be ending up causing yourself more problem. That's why some people, when they eat the wrong thing and they eat the wrong portions, or incorrect portions, they end up, not losing weight and not being beneficial in terms of what they're aiming for. Definitely. So remember, stop fasting immediately. I mean, immediately. If you're feeling faint or confused, if the sugars drop or they go very high, then you have to definitely break the fast, and head to the A&E. If you've got severe chest pain or severe headache, then you can break the fast. If you have persistent vomiting, remember, when you're vomiting, you're not only losing the food or whatever it is you've had, you're also losing the nutrients which keep the body going, and so therefore you will soon become someone of negative equity, and you don't want that. Okay, so remember, in cases of emergency, 111, 112, 999, these are all at your disposal. Remember, your health comes first. Okay, these are just telling you about the children and the adults, the ones that are prone, and what you need to avoid, and when you're fasting, who can fast, who cannot. And if they're still growing, then you're not incumbent on them. But by the time they get to puberty and 12, 13, they definitely should be able to fast. We can ease them into that gradually. Okay, medical advice definitely is essential for you to be able to do that. Prepare. Definitely. Remember that when you prepare, you get better, you enjoy it better, you get better benefits, because if you do that, you will cope better with hunger, and with that, you can actually get more benefits from it. But if you are struggling, then remember, you can get distractions. And the only way there are ways you can get distracted to help you cope with the hunger. You can pray, you can meditate, you can read, and of course, you can get involved in your community activities. But remember, sleep well. It is good. If you go into the bedroom, don't put the TV on. Don't take your phone with you. Make sure you're tired before you go to bed. Because if you're not tired when you go to bed, you're not going to be able to sleep. Don't take the phone. It would ring, it will buzz, and the TV should be off, and the windows, the blinds pulled, so you'll be able to sleep. Yeah? Remember, when you're fasting, don't overdo the exercise. You can walk briskly. Don't do it heavy, because you're going to cause yourself problems. Yeah? This is just a summary of what the takeaways are. Yeah? Quality. Definitely is quality over quantity, and not the other way around. Listen to your body. It talks to you. It speaks to you. Listen to it. Yeah? The benefits are there, but it's not without risks. Be mindful of the risk. Not everyone should fast. Remember that. Stop the medication only with the approval of your GP or the healthcare professional. After which, you then have your review, your tests, and of course, your exemptions if required. Plan ahead. Eat the nourishing foods. Know when to stop and get adequate sleep, and avoid physical activities in excess. So I've talked a lot, and I'd just like you to listen to this.
You can have 1,000 problems in life until you have a health problem, and then you only have one. Everything else, money, relationships, stress, fades away in its shadow. Suddenly, the things you once worried about seem so small, because nothing else matters when your body or mind is screaming for help. Health isn't just something you have, it's everything. It's the ability to wake up and feel alive, to move freely, to laugh without pain, to breathe without struggle. But we take it for granted, don't we? Until it's gone, we don't truly understand how precious it is. When your health is compromised, every little thing becomes harder. Dreams get put on hold, and life's colors start to fade. That's why taking care of yourself isn't a luxury. It's an act of love, a gift to your future self. Because when you're healthy, you can face anything. Without it, even the smallest battles feel impossible. Don't wait to lose it to realize its value. You can have one thing.
That's it. Oh, this is just my final slide. I like it. It may be religious, but I think it applies to everybody. You know, it is a hadith, prophetic hadith by our beloved Prophet, Mohammed, peace and blessing be upon him. He actually said, take care of 5 before 5. So you were born and you will get old. So take care of your youth before you get old. You're healthy now, like Denzel just told you, sickness will set in at some point. So take care of your health before sickness sets in. Yeah? If you have money now, you're wealthy, you're rich, at some point, something will happen, you might become poor. So look after the wealth before poverty sneaks in. And of course, if you are free now, there will definitely come a time when you get preoccupied. So look after the free time, take care of it, be meaningful so that it becomes beneficial, so that when you're preoccupied, you just flow along. And finally, you're alive now, we all are, but death awaits all of us. So make your life meaningful, beneficial for you before death comes in. I yield and I thank you. These are my references. Thank you so much.
Thank you, Dr. Kamara, for that lovely and very, very insightful presentation on fasting. I definitely learned a lot. I hope everyone on this call learned too. So we'll just quickly move over to the Q&A sessions. Got quite a few questions. If you have any questions, please put them in the chat. We will try to answer them. Thank you so much. So firstly, can fasting worsen anxiety or low mood, and how do we manage that?
Well, I don't know if you saw my slides, the last, I think last 3, where I mentioned, you know, people get hungry. Yeah, hungry. H is obviously the hunger. Angry, you definitely get irritable. That's something that is there. So for you to control that, as I say, it's either you're not coping or maybe the hormones are playing havoc. Therefore, you can get distracted, yeah, by reading, by meditating, by probably involving in other activities that would take your mind away. Anxiety in itself is one problem you would have, but for you to know whether the anxiety would worsen or not, if you're not taking your medication, at the required time, you need to be able to get assessed before you start fasting.
Thank you so much for that.
Okay.
Another question that someone asked, for women managing conditions like fibroids, PCOS, heavy menstrual cycles, is fasting advisable? And how can they protect their iron levels if they do choose to fast?
Well, I think if I understand it correctly, you were alluding to the heavy bleeding.
Yeah.
Right. Okay. They obviously will become anemic. And with anemia, obviously, there are other things that happens. You know, your cardiovascular system becomes challenged because you're now working in excess. Yeah, the heartbeat will go high because the tank is halfway full. So now you get tachycardia. And with that, there's a possibility of heart failure. Okay. All of these things can be, so as I said, for you to delve into that, you need to be able to understand that there are clinicians there are professionals there that would assess you. But more importantly, if a woman is in her menses, is in a period, then she's not allowed to fast. So if you are having that continuously, then obviously you might be one of the category of people, one of the categories that are exempt. And so therefore there are other ways of actually recompensing for that. Yeah. If you speak to your faith leaders, the imams or the rabbis or the reverends, they will tell you as it is definitely what you can do. People say you can feed a fasting individual or someone who cannot provide for themselves when they're fasting. Like you're feeding the fasting individual for the whole month, that would probably be something equivalent, but a recompense of some sort. Yeah. And as I say, some people can fast even though they're breastfeeding, for example. Some people can fast even though they are pregnant, but not everybody. So if you know that you're in that category where you've been assessed and you can't, or you're anemic, then obviously please don't try it, because what you're doing there is you're causing havoc to yourself, and that's not what you were given the body for. You were loaned it to look after it. You were trusted with it, so make sure you make good of it.
Thank you. And you also answered another question about pregnant or breastfeeding mothers deciding whether to fast on what signs. So like you said, some people choose to, some people choose not to because various red flags, or they have like past medical conditions, or the fact that this is like their first pregnancy or breastfeeding as well. So just listen to your body and speak to healthcare professional advisors.
That's it. The body tells you, and that's it. I mean, some people can. There are people who are, you know, God-given, if you like, privileges like that. But at the end of the day, it is important to remember that, like, look, don't go and do things that you know are beyond your ability to cope. Definitely.
Thank you. So Jaludin put, does fasting put your body in starvation mode and cause you to store fat first? So sometimes you end up with more fat at the end of Ramadan. Is there any truth in this?
No, I think what is alluding to is you go into a state of ketosis.
Mm-hmm.
So you're burning the fat, and of course, by the time you break fast, you then sort of replenish some of it. However, depending on the kind of food you eat and the amount that you eat, clearly, if you were losing 10 and now you're replacing it with 20, well, clearly you're not going to get any benefit from that. You see what I'm saying? There has to be that negative equity. You see what I mean? For you to be able to achieve that goal. If you end up because people don't lose weight sometimes because of the wrong food, because of the wrong quantity, and because of the wrong way of doing it. This is why you need to know how to do it in order to achieve the positive benefits from it. I hope that's clear.
Yes, thank you. Are there any particular nutrient deficiencies that are more common in African or Caribbean heritage that we should be mindful of whilst fasting?
I mean, the fasting is fasting. I think we're all the same people, you know, whether you are African, Caribbean, whether you Caucasian or not. If you're fasting, you go into you digest what you've eaten, and then you go into this ketotic mode. And then, of course, the ghrelin goes up like anybody else. The leptin goes down like anybody else. Yeah. You begin to experience the same constipation. Yeah. If you're not hydrating, obviously you get the vitamins going down. Obviously, for us as colored people, African Caribbean, because we're not getting much of the sun to penetrate the skin to get the vitamin D, obviously, because of the melanin, we definitely lose that much, especially in places like England, which is a temperate climate. So, yeah, so that is important to replenish that. There's no questions. But, you know, we do what you can and make sure you get the best of a bad situation, as it were. But I don't think there's anything specifically, aligned or assigned to being Black or African or Caribbean when you're fasting in terms of nutrients. It's your human body. It's the same. You lose, whether you're Black or white.
Just trying to see. There was a question about medical red flags that someone should break their fast immediately, but you touched upon in the slides that you should go. The 4 points you touched upon, that you should go to 9. I mean, you can either go to A&E or do 111 if any of these red flags come.
Yes, indeed. As I said, they're there. If you find somebody slumped and maybe this person diabetic, then obviously, and they were fasting, then some sugary drink or something, sugary, a toffee or something, or sweet in the mouth, or banana or something, if they can get it, and soon they might wake up, and that's it. But the longer you leave it, the more likely they sink into that stupor, and that is not going to help. Likewise, with blood pressure drops, like for example, someone hypertensive and has had the medication and has been fasting, and you find them slumped, there is something called postural hypotension. You stand up and the blood pressure drops and the heart cannot carry you further, therefore you slump. If that person is on blood thinners, be mindful. They may have banged their head and it's innocuous. You didn't see it because there's nothing outside, but inside they may be bleeding. Therefore, you need to be assessed. Yeah, it may be the heart that is obviously slowed down. Yeah, or the blood pressure is not maintained. Therefore, they're in trouble. So if you speak to 999, they will definitely guide you, because they'll ask you, are they breathing? Can you feel a pulse or not? And if you can, then put them in the recovery position as they make their way. They're not breathing. They'll tell you there's no pulse. Then go on for CPR.
Yeah. Thank you so much for your insightful presentation. I definitely learned a lot, took a lot away from just eating as well, not even fasting, like just having like a balanced diet.
Thank you.
As well as fasting as well. Someone said, can one drink water during fasting times? I think it depends. And the thing with Ramadan, you don't drink or eat during the whole period.
The only thing you're allowed is your God-given saliva.
And the last person, Iyabo, said, just to confirm, if one has kidney problems, it's not advisable for such person to fast.
Again, I don't want people to misconstrue what I said. That slide is specific. I don't know if I can go back to it. It is absolutely vital. If I can share it again, sorry. Right. This slide. If you watch the red on the slide, oh, it's not coming up. Ooh, what have I done? I don't know why it's done that. Right. I don't know if you can see the red there. Yeah, that's it. Can you see? There's kidney there. So someone on dialysis or chronic kidney disease, stage 4 or 5, you're a very high risk, and so therefore fasting is not recommended for you. However, for that to be the case, i.e. for you to be put here, you need to be assessed. Remember, assessment, medication, and education. That's what I'm talking about. Once you get that, preferably 2 months before the fasting, but at least 1 month, you'll be able to tell whether you are red, orange, yellow, or green. Green, definitely you can fast. But remember, it overlaps. There's some yellow that can fast. There's some yellow that cannot fast, again, depending. There's amber, but definitely the red, I wouldn't recommend fasting.
Thank you very much.
All right.
If anyone wants to access the presentations, it can be accessed on the YouTube page. Feel free to like and subscribe and be updated when we go live. Thank you so much for joining. Thank you for your insightful questions. Thank you for the insightful presentation, Dr. Kamara. I'll just hand it over to Wisdom.
Thank you so much, Tayo, for hosting. Thank you, Dr. Kamara, and everyone that joined today. Yeah, today has been very insightful. Yeah, I've picked a lot from it. So I hope everyone is able to digest the information. And I wish all our Muslims colleagues that have joined this meeting in the Black community. Happy Ramadan in advance. So I will share my screen now for everyone to know what Khan is about this year in terms of events and programs. Second, please. So. All right, yeah. So if you can see my screen, we have same time next week, another health hour, and it's very important, another very important health topic. That's on the 1st of February. So we kindly ask everyone to share the link with family and friends to be able to join us. Our goal is to help more people to improve their health and build stronger health literacy. Yeah, and also we have the Black Towers. This on 4th of this is the third year. This is the third year, and the past 2 years has been very, very interesting. So we are announcing nominations are open, and if you know any Black health professional who is making any difference or take a moment to nominate them. And also, if you are a Black health professional and work in any of the health sectors and do anything outstanding, we encourage you to submit a self-nomination as well. This will be an excellent evening, and which we are looking forward to shine spotlight on all Black health professionals and breaking barriers, making changes, and making a lasting impact in healthcare. We can't wait to celebrate you. So the deadline for the nomination is 29 February 2026. And if you have any inquiries, you can contact the Black Health Care Awards at can.org.uk, and you can scan the QR code to make your nominations now. So we have the International Women's Day. It's all about celebrating women, honor them, and uplifting all the women around the world and then our community. So this event will feature in engaging workshops, talks focus on physical and emotional psychology and spiritual well-being. It will be a powerful and enriching experience designed to support women in every area of life. So this will be held on the 12th of March, 2026. Please reserve your spot by scanning the QR code, and if you have any questions, you can reach out to events@can.org.uk. And finally, is the 2026 COVID reflection. It's been 6 years now since the breakout of COVID, and we are coming together to honor lives, uplift resilience of the community and African community, and create space for collective healing and hope. So you can join us. Please join us on the National Service, Remembrance and Unity to reflect on our shared journey through the pandemic. So this will be on Sunday, 8th March 2026, from 7 p.m. to 9 p.m. In Manchester at the Manchester Monastery. So there's information on the screen. Any inquiries, you can still reach out to us on event@can.org.uk, and to register, kindly scan the QR code. Thanks so much for joining us today, and we hope to see you all next week. Over to you, Tayo.
Thank you all. Have a lovely weekend ahead.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.